I just got off call with a client, and one of their primary concerns was trying to get their doctors to listen to them instead of pawning them off with just one diagnosis. Primarily, what this client was receiving was a diagnosis of anxiety. And so I think it's very important to ask the right questions of your provider, and that's why I popped on to just share with you some of those questions that might get you a little bit further in your healing journey. And if anything, will give you some clarity as to what that medical provider can offer you versus what you might be seeking or might need to seek from another source. So asking the right questions, maybe you can ask in some form, what test have you done to rule out other causes? And if you have already worked with this primary care who maybe has referred you to other practitioners, other doctors, you may have done numerous tests, but the goal is to make sure that the testing is cohesive and complete. And it really needs to paint a picture of the overall function of the body and not just focusing on one symptom. In this particular case, could be the neurological symptoms or psychological symptoms. In addition to that, you may want to ask, what is the treatment plan beyond treating anxiety? Yes, taking a pharmaceutical may alleviate some of that initial angst, but you know that there's other underlying causes that need to be addressed, or in the very minimum, or at the very least, you want to restore balance to all of the systems. So what is the treatment plan that your doctor has in mind, or is it just perpetual prescriptions of pharmaceutical? Additionally, you'll want to ask, have we ruled out conditions that mimic anxiety? A lot of people with dysautonomia or autonomic nervous system disorders, they do experience all of these symptoms like the tachycardia, lightheadedness, nausea, inability to eat, food aversions. You might have palpitations. You might have these cortisol or adrenaline rushes. Again, all of these mimic anxiety. In some particular cases, there's anxiety around the symptoms. So yes, one may cause the other and vice versa. It's kind of a vicious cycle. So addressing the triggers of this anxiety response is best for you ultimately. And finally, you can ask your doctor to explain why he or she is confident that it's anxiety and not some other physiological condition. So keep the questions coming. When you share your questions, even if you think they're not on topic, they are very helpful not only to address your concerns, but to also address other people that may be going through similar concerns. All right. See you on the next one.